Liberia has made remarkable progress towards the reduction of infant and under 5 mortality. The rates were 58 and 78 per 1,000 live births respectively in 2010 in Liberia. This decline of over 68% from the 1990 levels of 241 to 1,000 under 5 mortality rate represents an extraordinary annual reduction of about 5.4%, the highest in Africa. The commitment redoubled efforts to achieve Millennium Development Goals MDGs 4 and 5 by 2015, specifically to reduce under 5 mortality in all countries to 20 or fewer under 5 deaths per 1,000 live births by 2035, and to focus greater effort on reaching the most disadvantaged and hardest to reach mothers and children in the country. The Race for Survival is the centerpiece of Save the Children's Global Day of Action, meant to advocate for better health care and services for newborns and children to enable them survive the first month of life and beyond the age of 5. Being the charity's biggest annual child participation event, the 2013 Race for Survival witnessed children directly advocating for the institution policies and measures by the Government of Liberia and donor partners to further reduce deaths of newborn, children under age 5, and mothers from pregnancy-related complications. The kids kicked off the campaign with a media tit-a-tit, which also included Save the Children's Liberia program officials to provide information. The pre-event media discussion highlighted the gains made by the Liberian government and its developmental partners like Save the Children aim at achieving MDGs 4 and 5. Goals 4 and 5 seek to reduce child mortality by 2/3 and improve maternal health respectively. Student Janet Lepolu of the Obas Girls Educational Foundation, Ranjan Pujal and Dr. Olusola Oladiji, Country Director and Health Program Manager of Save the Children, provided the essential information to the media.
We, on behalf of the children of Liberia, are in support of the effort Save the Children and the Government of Liberia is making to make sure that children of Liberia do not die from common diseases.
Thank you very much.
Malnutrition is definitely one of the causes of child mortality, and right now in Liberia we've got there's a high percentage of chronic malnutrition, which is 38%. Some reports say it is 42%, and the way to do that to reduce malnutrition is, again, there are several ways of doing it. And this also needs a comprehensive, all-inclusive approach to working on malnutrition. This has to do with the food people intake, the food that the mothers take, and during pregnancy and after the birth of the child. This also has to do with what the child is fed during early years and later on in life.
What the children of Liberia feel the government needs to do more. So all these are packaged in this race for survival. We are asking that the focus of 2015 post agenda, the framework should also include issue of newborn. So we are lobbying. It's at this stage, they are just developing what will happen after post 2015. So we are lobbying to ensure that it becomes a reality. So that's our focus. That newborn agenda is really flagged out when it comes to the issue of post 2015 agenda. That's our focus as a Save the Children. So that we know if we can address on newborn, we can address on the 5 mortality.
October 23, as their colleagues around the world were advocating also, the Liberian children assembled at the front of the Capitol building, the seat of the Liberian legislature. Their presence raised concerns as to their mission. Indeed, they went to their lawmakers with a petition to make sure that by the end of 2015, the government of Liberia, with support from donors and partners, boldly take steps to help end the death of children from preventable causes. At the petitioning ceremony, the children also presented copies of Save the Children's latest child survival report. The report, titled Lives on the Line, an Agenda for Ending Preventable Child Deaths, calls on world leaders to commit more to child survival if the gains made must be sustained.
Let the government also make sure that each child, no matter where in Liberia, receive free vaccine and choice up to 5 years old. Make sure that every child, no matter where in Liberia, is delivered by trained midwives in their clinics. Good food and safe drinking water to help keep us healthy. Put more money in the budget that will help us to have good hospital and clinic.
Receiving the petition, Boweh County Representative and Chairman on Youth and Sports Lester Pay, flanked by his co-chair, Representative Solomon George, told the children that the government will listen to and act on their requests.
In everything we do, the welfare of our children is very paramount. In any progressive society that doesn't emphasize the health of its citizens, that society is doomed. And so Liberia, as a developing country, and with the dynamic president that we have, that cares for the lives of children, the health and education of children, we want to join the government to say to our children that we will do all we can to make sure the health needs of our citizens, especially our children, are emphasized. More besides, to say race for survival is not only for the children, it's also for the elderly, for whoever you are in our society. One specific instance that caught my attention most is the issue that they are asking their representatives to advocate to provide for provision in the budget that will increase and accelerate good primary health care for our children, and also to equip our various hospitals, our various health centers, so that tomorrow our kids will be well. For the level of the Committee on Youth and Sports, I chair, flanked by my co-chair and the members. You can rest assured that your petition will be presented to leadership.
The Race for Survival, which is the main mobilization activity for the day, was held on the 31st of October and is meant to take key campaign message to a bigger audience. Though it was organized for 600 children from 6 schools, the event at Don Bosco Youth Center in Matadi Estate brought together over 1,500 children, 30 of whom actually took part in a relay athletic race. To continue the advocacy and raise awareness on better health care for the children, a popular musical artist, Evie Nat Kamara, and comedian Gisedi joined the case.
We notice that most of the time children die under 5 years old because of certain illness that can be prevented. And most of the time we don't prevent those sicknesses and we cause the children to die. So we the children, we are children today, we are running for our survival. We say that children under 5 years old shouldn't die from sicknesses that can be prevented.
Okay, I cannot get one every month. I cannot get one every month. You don't cheat, you don't cheat. You listen to the math. 2x. That quadration equation. Quadration equation. 3x plus C 21. 21 minus 3C. 3C times to 2x. 2x squared 39. 39 plus 38 equal to 1.
The celebrities first did a symbolical run before the Race for Survival officially kicked off, with kids from the 6 schools running for child survival across Liberia.
So I will 3, 2, 1.
Save Thursday, October 23, 2014 as the next date for the 2014 Race for Survival. Save the Children will again plan another Race for Survival for the Liberian children with new advocacy acts to healthcare for children. Save the Children is the leading independent organization that creates lasting change for children in need in Liberia and around the world. Save the Children Liberia works on 3 thematic areas: health, education, and protection. It also works in emergency situations. The charity supports child protection systems. It strengthens the enhancement of the capacity of key government ministries and agencies, and its work is guided by the UN Convention on the Rights of the Child and other local policies that protect the rights of children.